So if you want to see the whole jaw, there are multiple diseases. So you will go for panoramic radiograph so that you can see all this tooth all together. Then, if you think that I need to see this particular teeth with better resolution, you need to go for periapical radiograph or bite-wing radiograph, depending upon the tooth or teeth. Or sometimes in your facilities you don't have. Nowadays we use CBCT extensively in our dentistry, which is specially made for dentistry. So for simple impacted canine, impacted third molar, or implant site assessment, we go for CBCT. But this is not available to everywhere. So what will you do? Then you need to go for 2D radiograph. So maybe periapical radiograph for the impacted canine, or for impacted canine you may go for occlusal view, and maybe to determine the position of the tooth, whether it is buccally placed, lingually placed, you may go for slop technique. You will take 2 radiograph, and whether you will determine whether this tooth is buccally presented or lingually presented. So depending upon your infrastructure, you will choose your radiograph. Sometimes there is road traffic accident. Sometimes there is for young children patient, the trauma of the, especially the anterior tooth, is very common. Sometimes they will come to you with a broken teeth, or teeth is avulsed, missing tooth. So, but there is a soft tissue laceration. So you need to check this one. We need to check the lacerated tissue, whether any broken part of the tooth is embedded in the soft tissue or not. Then you will go for extraoral view. Okay. So depending upon your diagnosis and your need and your infrastructure, you will choose your radiographs. For caries lesion, which is very common disease alongside with periodontal disease and periapical disease, our first and for most common radiograph would be for posterior teeth to caries determined would be bite-wing radiograph for premolar and molar, so that we can see the proximal caries as most clearly. The bite-wing radiograph will give you the best possible details, fine details of this caries lesion. In the anterior teeth, obviously, you will go for periapical radiograph. And also, depending upon the age, oral hygiene, or caries activity, you will prescribe your patient that you need to come for after 6 months follow-up, or after 1 year, or 1 to 2 year follow-up, depending upon the age of the patient, oral hygiene history of the patient, and caries activities. Okay. So, as I mentioned, the bite-wing and periapical radiograph are the examination of choice in case of caries lesion. So sometimes it is very common that we miss some caries lesion in case of while examining the patient. So the radiograph will help you to determine, especially the proximal caries. Sometimes it is very difficult to see in between 2 teeth, and also sometimes if it is very advanced caries, or not so severe, moderate caries, mild caries, so it is very difficult. Tiny caries lesion is very difficult to identify. So the clinical examination may not be sufficient to determine this caries lesion. So you need to go for radiographs, bite-wing or periapical. Periodontal diseases, as you know, the periodontium means these 4 contents: alveolar bone, periodontal ligament, cementum, and gingiva. Sometimes you will see there is a recession with the bone loss. Sometimes there is a bifurcation involvement. Then you need to go for radiograph. So in case of periodontal disease, there are sometimes localized and generalized. If it is localized, you think there's only one particular segment or one particular teeth or two or three to one side, then you go for periapical radiograph. If it is extensive bone loss in both jaw in one side, you may go for bite-wing radiograph, which is vertically placed. Okay, so that you will get the best possible view of these bone losses. But most of the cases you will see there is generalized cases, generalized periodontal disease or bone losses. Then you will go for panoramic radiograph to see the whole jaw in one radiograph. So you don't need to expose the patient multiple times. So most of the cases, with the patient from 50 to 65 years or more than that are periodontal disease you will find. And the radiograph will help you to evaluation of the disease or extent of the bone loss. But always, first you will have the clinical examination. Clinical examination will indicate you what type of radiograph you need for this particular patient. So radiograph will see, demonstrate the extent of the disease, the local factors. Sometimes there is any calculus is there or overhang restoration is there. So it will determine you to remove the causes or for proper treatment planning. So, and if it is localized, the bite-wing and periapical radiograph would be your examination choice, or if it is generalized, you will go for panoramic radiograph. Another common disease is periapical lesions. So this is the sequelae of carious lesion or periodontal lesion. If you will see, remember this sequelae. From the caries or trauma, there will be necrotic pulp, apical periodontitis, then it may turn into abscess or granuloma. Then you will go for, it can turn into a cyst or osteomyelitis. Okay. So in that case, if there is you're suspecting any swelling, is there any sinus tract in one particular teeth, you will go for periapical radiograph. Okay. In periapical radiograph, at first you will go for periapical radiograph if swelling is a small one. If it is large one, you will go for panoramic radiograph to see the whole extent of the lesion. Sometimes the periapical radiograph will not give you the exact in the periapical radiograph, the whole lesion cannot be accommodated, so that you need to go for panoramic radiograph. So depending upon size and shape of the disease, you will determine, but you don't know, you cannot see the naked eye. So it's better to have a periapical radiograph. Then if needed, you'll go for panoramic radiograph. So sometimes clinical presentation does not necessarily correlate with the history and radiographic findings. So you may think this one is this disease, but in the histological findings or radiographic findings may give you another information. And I forgot to mention in the carious lesion also in the what you see in the radiograph, actual carious lesion is much more bigger than that in the radiograph.